Hi, I'm Dr. Tracey Reed, a psychiatrist, and I make mental health education videos. Today, I'm answering a viewer question to talk about body-focused repetitive behaviors. This is a broad term for a specific type of compulsive behaviors that cause self-injury. The two most common behaviors are hair pulling and skin picking. These two have official names in the Diagnostic and Statistical Manual of Mental Disorders. Hair pulling is called trichotillomania, and skin picking is called excoriation disorder. Even though trichotillomania has mania in the name, it has nothing to do with the mania of bipolar disorder. In fact, trichotillomania used to be listed under impulse control disorders in the manual, and now it's listed under obsessive-compulsive and related disorders, and this characterization is a better match for these behaviors because they really are more compulsive than impulsive. You don't just randomly do them, you can't stop doing them. There are also other compulsive body-focused behaviors that I'll mention later, but these are the two that are listed as disorders in the diagnostic manual. So first, trichotillomania or hair pulling. With this disorder, you pull out your own hair repeatedly. It's usually strand by strand. Have you ever played with your hair or pulled on it while you were reading or studying? This is not the same thing. You can do that with trichotillomania, but it's much more than that. Usually, the urge to pull the hair is preceded by anxiety or a buildup of tension. Then pulling the hair relieves that tension. Sometimes, random hairs may satisfy that urge, but many times it needs to be a certain kind of hair, like the certain hair texture. And some people get a lot of pleasure from seeing the white root at the end, and you've got to pull just right to get that white root. So this is one reason a person can pull many hairs until they get the right presentation. Then it's common to manipulate the hair afterwards. You may like the way it feels rolling in your hand or in between your teeth, and some people will even suck on the root of the hair. Then there's usually a lot of relief or gratification from this ritual, but the relief is short-lived. Because part of the criteria for this behavior is that the behavior ultimately causes distress, you can feel shame for needing to do this, or frustration over your lack of control. You make attempts to stop it, and you may stop for a while, but then something will trigger you to start up again, and because it's a compulsive behavior, you can't just do it once. You can pull hair from anywhere on your body that has hair. The usual places are the scalp, the eyebrows and the eyelids, or your eyelashes, and you may change up the site from time to time. Also, you're usually trying to hide this from people. So if it's a place that's noticeable like your scalp, you may wear scarves or hats to hide the bald spots, or you may pick different places so that you don't have noticeable balding, but instead your hair just may look thin. Normally, this behavior is driven by negative emotions, but sometimes you can fall into an automatic behavior of pulling your hair without much conscious awareness. An example of this would be pulling your hair while you're reading or doing something else. And in this case, the hair pulling can be a soothing behavior, similar to a child sucking her thumb. And it still serves the purpose, though, of calming mental tension, but you're not intentionally pulling the hair to get relief. Some people with trichotillomania may pull other hairs, like the hair from a pet, or fibers from a sweater, and this would be an extension of pulling your own hair. So the problem starts with pulling your own hair first, and then you may do these things later. Next is skin picking or excoriation disorder. This behavior has a lot of the characteristics of hair pulling, except you're picking your skin to the point of creating sores. The common places are the face, the hands, and the arms. Most people use their fingernails, but some people can use tweezers or bite the skin. Biting is usually what you see in someone who bites at their hands or their cuticles. For example, if you're studying or working, you may be writing with one hand and then biting or chewing with the other hand. Sometimes, you may focus on a pimple or a bump, but most times, people pick at healthy skin until it makes a sore, then you'll later pick at the scabs. Similar to the rituals with trichotillomania, some people will play with the scabs or even chew on them. People can spend hours doing this, and they usually hide it from others. Both of these disorders usually start in adolescence right around puberty, and it's usually chronic, meaning it can last weeks to months or even years at a time. It can come and go, though, with long periods in between where you're not doing it. When it's a problem, the problem can be mild or severe. Mild could look like some hair pulling that you really don't spend a lot of time on, but you still don't like that you do it. You may have a few chewed fingers or a thin area of hair in your temple that's not very noticeable, and you can manage to break the cycle and stop doing it. A severe case of skin picking can lead to serious infections like cellulitis or even severe scarring. So those are the two body-focused repetitive behaviors that are listed as disorders in the DSM manual. Oftentimes, a person with either of these will engage in other repetitive behaviors. Some other body-focused repetitive behaviors include nail biting, also called onychotillomania, lip biting, and nose picking. What's the treatment for this? People with mild cases can go without treatment, and the problem can resolve on its own. Since it's a compulsive disorder, though, the issue is being able to control the urges. If you have a mild case, you can recognize and avoid triggers or find ways to distract yourself. When you can't control it on your own, there's therapy. Some of the things therapies use to help this condition are habit reversal training, which is a type of cognitive behavior therapy, and a self-help technique called decoupling. With decoupling, you perform a different behavior whenever you feel the tension that normally triggers a compulsion. The idea is that this other behavior that you do decouples or disrupts the connections between the emotion and the compulsion. Engaging in the other behavior allows you to gain some control over the compulsive behavior. We don't have any medications that are standardly used for this disorder. There has been some evidence, though, that inositol and N-acetylcysteine have been helpful. Both of these are supplements that you can get without a prescription. Other alternative therapies include yoga, aerobic exercise, acupuncture, biofeedback, and hypnosis. Watch this video for more on obsessive-compulsive disorder. See you next time.